In this video, we'll talk about signs of live birth. So, fetus was born alive after the complete birth. At least one part of its body comes out from the mother's womb, indicates a live birth. So, fetus has to be alive after the delivery, and during the delivery, at least one part should be coming out from the mother's womb. It is nothing but a live birth. So, in civil cases, infant crying immediately after the birth. So, crying is nothing but the first breath of the infant. So, inhalation of air happens. Respiration is taking place by the infant. Crying immediately after the birth, sneezing, yawning, movement of the limbs, muscle twitches. These are all indicative of live birth. Coming to criminal cases, it is somewhat different from the civil cases. So in civil cases, only these things will indicate live birth, whereas in criminal cases, you have to do postmortem examination and prove that the baby was alive during the birth or dead during the birth. So signs of live birth can be demonstrated by postmortem examination, by these external findings and some internal findings. So under external findings, we'll talk about skull, skin, chest and umbilical cord. Let us talk about skull. So under skull you have two things. One is caput succedaneum, another is cephalohematoma. So what is caput succedaneum? The baby is being taken out from the mother's womb. There will be a stagnation of fluid because the baby is being stuck in the pelvic girdle. There will be stagnation of fluid between the layers of the scalp. It leads to a swelling that is called as caput succedaneum. So it is present at the time of birth and disappears after one day. It can be present bilaterally. Coming to the cephalohematoma. So it is a collection of blood between the periosteum and the skull, between the skull bone and the layer covering the skull bone, that is periosteum. There will be collection of blood because of the rupture of the small emissary veins from the damage induced by this forceps delivery. It is usually unilateral and it appears after one day. It is not present at the time of birth, whereas caput succedaneum is present at the time of birth, disappears in one day. Here the cephalohematoma is not present at the birth, appears after one day. Cephalohematoma decreases in 6 to 8 weeks of period. So this regression process helps us conclude how many days this infant has survived after the birth. Caput succedaneum is a definitive feature of the live birth because this is present at the time of birth, whereas cephalohematoma helps us indicate how many days this infant has survived after the birth. Chest is flat in case of dead born because no respiration has taken place, whereas it is drum shaped in the live birth because of the inspiration or the respiration has taken place. Umbilical cord. When you see this clean cut margins and the marks of crushing by the artery forceps, it indicates the baby's live birth. Right, because when the baby is being taken out, the nurses or the gynecologist cut the umbilical cord with the artery forceps. So you can see clearly the clean cut margins and the crushing by the artery forceps, which indicates the baby is being taken out alive. So these are the different changes in the umbilical cord according to the time. So drying out of the cut margin will be occurring within 2 hours. Drying of the cord will be occurring in 1 day. Inflammatory line at the base of the stump is seen within 2 days. Obliteration and the mummification, where you can see this umbilical cord turning into a black color thing, you can see within 3 days, and it detaches and falls off within 1 week. Complete healing will be seen under 2 weeks. So these are the different changes in the umbilical cord seen according with the time. Now coming to the skin. So the absence of vernix caseosa and presence of clothes. What is vernix caseosa? See, this is the vernix caseosa. You can see this cheesy type of layer over the skin of the baby, right? This is the vernix caseosa. After the baby is born, you'll generally clean this vernix caseosa and you'll put the clothes on, right? So absence of this vernix caseosa and presence of clothes indicate that the baby is born alive, bright red in color. It indicates the just born fetus. The baby is turning darker. That means its delivery has happened 2 days ago or 3 days ago. If the baby is turning from the brick red to yellow to normal, it is because of the physiological jaundice. It is seen in 1 week old babies. So this is about the external findings, right? Here we talked about skull, chest, umbilical cord and the skin, which are used to remember the subheadings should be written under the external findings. First thing is skull. When you see the baby externally, you can see the head of the baby, right, which reminds me of skull, and also the color of the baby, which reminds me of skin, and then the chest of the baby. The peculiar thing which you can see in the infants is cord, umbilical cord. So these are the 4 things I'll write under external findings. Now coming to the internal findings. The first thing is lungs. So unrespired lungs and the respired lungs. We'll see the differences between them. Under unrespired lungs, we are talking about the dead born fetus or the stillborn fetus. Under the respired lung, we are talking about live born fetus. Unrespired lungs, it is bluish or red in color with a small volume because obviously respiration has not taken place. Air has not entered the lungs and pleura will be loose and wrinkled, but the lungs will be dense, firm and non-crepitant consistency. You can also see the sharp margins because the lungs are so small. The diaphragm is at the level of 4th rib. When the blood is oozing out from the mouth, it's usually frothless because there is no air present in the lung. Alveoli are not expanded. Alveolar sacs are also closed and lined with the cuboidal epithelium. Now coming to the respired lung, it is malted and large volume. The air is present in the lungs which gives the lungs its volume. So the pleura is also stretched and taut, and the lungs are soft, spongy, elastic and crepitant. The margins are round and the diaphragm is at the level of 6th to 7th rib And here you can see this frothy blood oozing. If the blood is oozing from the mouth, it will be frothy because of the air present in the lungs. So alveoli, as they are getting filled with the air, it expands. Alveolar sacs are also dilated, and it is lined by the flat squamous epithelium cells. And another very important point you have to remember is prominent vascularity. So when the respiration is happening, the blood flow will be increasing in the lung, which is nothing but increase in the vascularity. So you can see this prominent vascularity in the respired lung. Now let us talk about three tests. A 4D test or the static test will see the weight of the lungs. So lungs are taken out from that fetus and they are ligated at their hilar. Weight varies in unrespired lungs and respired lungs. In respiration, there will be increased blood flow to the lungs. So as the blood flow is increasing, there will be increased vascularity, which increases the weight of the lungs also. In a respired lung, the weight will be 60 to 70 grams, whereas the unrespired lung 30 to 40 grams. Normally the stillborn lung is lesser weight compared to the live-born because of the live-born has respired and increased the blood flow, which increases the weight of the live-born's lung, right? But in cases like edema of the lung, congenital pneumonitis and inhalation of amniotic fluid, these are the cases in which the stillborn's lung are also increasing in the weight. So this is about Fodier's test or the static test. So in the spelling of this Fodier, there is a word red, right? F-O-D-E-R. When you reverse the D-E-R, I can see red. I usually remember this red with the blood flow. This Fodier's test is about blood flow to the lungs. Coming to the Plauchet's test. Here the ratio of weight of the lungs and weight of the whole body is taken out and compared. So first we'll measure the baby and then we'll dissect out the lungs from the baby and we'll measure the lungs alone. Now we'll do the ratio of this lungs by the whole body. If that is 1/35, then it is a respired lung because on respiration, so when you respire, the air in it causes the decreased weight of the lungs when you compare with the whole body. So this decreased ratio of weight of lungs by weight of whole body is seen in respired lung. That means in the live birth. So 1/35 is seen in live birth, whereas 1/70 is seen in unrespired lungs or stillborn or the deadborn. So this helps us demonstrate the establishment of respiration. It helps us know whether the respiration has occurred or not. Now coming to the important test, which is hydrostatic test or the flotation test. So this principle is based on specific gravity. Before the respiration is around 1040 to 1050, it becomes less, that means 940 to 950 after the respiration. So the specific gravity of the lungs is becoming less than water, which makes it float on the water. So before respiration, it will be around 1040 to 1050. After the respiration, the specific gravity of the lungs is 940 to 950. So because the specific gravity of the lungs after the respiration has decreased when compared to the water, it will float on the water. We have to dissect off the lungs and we have to tie it across the hilar region, put them in the water. If it sinks, it indicates unrespired lungs or the stillborn fetus. If it floats, take this lungs out from the tray of water, you cut it into small pieces, you squeeze them and again put the small pieces into the water. Again, if it sinks, it means it is an unrespired lung of deadborn or the stillborn fetus, and if it floats again, it means it is a respired lung of the live birth fetus. So what is the mechanism behind it? When we are taking out and cutting the lungs and squeezing it, even after squeezing, the residual air will be present in the lungs, right? Because of the residual air presence, this will float in the water. Presence of residual air indicates respiration has taken place and the fetus is live born. Atelectasis, obstruction by the alveolar duct membrane, edema, pneumonia, congenital syphilis. In these are the conditions where the hydrostatic test will be false negative. Whereas in case of accumulation of putrefying gases and artificial inflation, you can see false positive also. Coming to the histology. In the unrespired lungs, the alveoli are closed. Alveolar sacs are closed and lined with the cuboidal or the columnar cells, and less vascularity can be seen. And in the respired lung, they get flattened, dilated alveolar sacs can be seen, and it is lined by the flattened squamous epithelium, and increased vascularity is also seen because respiration increases the blood flow to the lung bed. Skull, which is another subheading of internal findings. So what you will see in the skull? Closure of fontanelles. This posterior fontanelles usually closure occurs at the time of birth. So you can see that. And also ossification centers. Different ossification centers close at different ages. So you can see from this, you can see the viability of the fetus. From this you can see how many days since the fetus has been alive for. Coming to the next internal finding, which is in middle ear. So in fetal life, there will be presence of this gelatinous embryonic connective tissue in the middle ear, whereas after the fetus is born, you can see air in it. You do not see this gelatinous embryonic connective tissue anymore. You can see air. So in the fetal life, there is presence of gelatinous embryonic connective tissue. In the live born fetus, there will be presence of air and absence of this gelatinous embryonic connective tissue. This is nothing but Brendan's test. So these are the changes which are seen in middle ear of a live born fetus. The teeth. In teeth, you can see neonatal incremental line in the enamel of the teeth, which is formed at the birth. So this is the neonatal incremental line, you can see it is only developed after the birth. This is the external finding of the chest. We have said chest is flat in case of dead born fetus, whereas the chest is drum shaped in case of live born fetus because of the increased anterior posterior diameter of the chest because of the inspiration. Now coming back to our topic, which is teeth, right? So you can see this neonatal incremental line in the enamel of the teeth, which indicates the baby is again live born. Now coming to the blood vessels and heart. So in the blood, you can see this absence of nucleated RBC within 24 hours. Fetal hemoglobin may be present up to 6 months. The main thing you have to notice in the blood is absence of nucleated RBC within 1 day. So if the baby has absence of nucleated RBC, that means the baby has been alive for 1 day. Now coming to the blood vessel. Umbilical artery obliteration occurs from 12 hours to 3 days. Ductus venosus and umbilical vein is obliterated under 4 days. Ductus arteriosus is obliterated under 10 days. Coming to heart, closure of foramen ovale is seen within 2 to 3 months. Stomach. So in the live born fetus, there will be presence of air in the stomach because inspiration has occurred. Live born fetus swallows air into the stomach during the respiration. So for this, how we have to test? We have to dissect out this intestine and the stomach, and we'll have to ligate it around the ends, and we'll put it in the water, and we'll cut in between ligation marks, right? Somewhere in between the two ligation marks, we have to cut it. If the bubbles are coming out into the water, then it means air is present in the stomach. If the bubbles are not coming out, it means no air is present in the stomach. No air in the stomach indicates dead born fetus. Air in the stomach indicates live born fetus. Why is air present in the stomach? Because the respiration has taken place. Air is swallowed into the stomach by the fetus. This test is very important. This is called Breslau's second life test or the stomach bowel test. B. Breslau stands for bubbles. And presence of milk in the stomach, again it is the surest sign of live birth. Live birth, the large intestine is completely free of the meconium within the first 24 hours. So if the baby, you'll see, and if there is no meconium present, it can indicate the baby is alive for 1 day. If the meconium is present inside the intestine, it can indicate stillbirth. There is some cases where even in the stillbirth you cannot see meconium, like if the stillbirth is along with the breech presentation or the hypoxia, there will be absence of meconium. So to remember all these internal findings, I have made this very terrible diagram. So the first thing indicates the skull and teeth and ear. So when you see the face of the baby, you can see the skull, right, and the teeth and ears. So with respect to ears, we'll see this gelatinous membranous connective tissue presence or absence. So with respect to the teeth, you can see this neonatal incremental line, and in the skull, closure of posterior frontal, and also this skull bone reminds me of other bones where you can see this ossification centers closing at different points. And the second point is heart. So blood vessels coming to the heart. So first point is blood vessels coming to the heart. Heart is the second point, and heart is pumping the blood out to the lungs. So this pumping of blood reminds me of another subheading blood. Pumping out to the lungs reminds me of another subheading lungs. So under the blood vessels, we'll talk about obliteration of umbilical artery, ductus venosus, umbilical vein, ductus arteriosus, or closure of patent ovale. In the blood, we'll talk about nucleated RBC are absent after 1 day. In the lungs, we'll talk about respired and the unrespired differences. Now coming to the stomach and the intestine. So stomach, presence of air and presence of milk indicates the live birth. And in the intestine, if there is presence of meconium, it indicates stillbirth. Because the meconium is passed out from the fetus after 1 day. So the baby passes his first stool, which is called as meconium, right? So if the baby's intestine do not have meconium, it means the baby has been alive for the 1 day. So this is about, I forgot the topic, signs of live birth. Thank you. Bye.